I'm really fortunate to be joined by Dr. Brian Kwon, who is the leader of the Knowledge Forum. Is it spinal cord injury? I get them all confused, and I'm getting older, so you have to forgive me. So Brian, thank you for taking the time, and I know you have limited time because you are doing so much at this meeting. But maybe for the audience here, just introduce yourself. Tell everyone a little bit about your practice.
Sure. So my name is Brian Kwon. I'm an orthopedic spine surgeon at Vancouver General Hospital in beautiful Vancouver, and a professor of orthopedic surgery at the University of British Columbia. And my practice is, at this stage, is a mixture between doing a lot of trauma and degenerative work, and my career has really been focused academically on doing spinal cord injury research, both in the lab and clinically. So that's really been the focus of my academic career is really around translational research in spinal cord injury.
Yeah, and I've known you for a while, and certainly you're considered one of the world's experts on spinal cord injury, and congratulations on all your accomplishments.
Oh, thanks.
I'm so happy to see you leading the Knowledge Forum. I think the audience, and half of the audience are members, the other half are just people that are registered for the meeting, and they're kind of tuning in virtually. I think they kind of understand the theory behind the Knowledge Forums. Maybe you could tell them a little bit about the sort of the rationale for the creation of your specific Knowledge Forum and what you guys are kind of doing just in general.
Sure.
And we'll get into specifics later.
Sure. Yeah, I think that spinal cord injury really represents one of the most catastrophic issues that spinal surgeons face, and I think that around the world it's like a massive unmet medical need to develop therapies and treatment strategies for it. So I think the Knowledge Forum is really being created out of the recognition that as spine surgeons we have a lot to offer in this patient population. The spectrum of research that goes into spinal cord injury really spans from very molecular discovery type research all the way to the end stage where we're operating on people. And within that spectrum, there's, I think, a lot that spine surgeons can do. Maybe we're not going to discover necessarily the novel molecules, but we can definitely do the kinds of research that surgeons around the world can put into today to try to improve the quality of lives people that suffer this injury. And I think that's really, where the Knowledge Forum kind of arose from, and what we're really trying to do in the future.
So, based on that, I mean, the Knowledge Forums are mostly clinical research. I would assume that you guys are mostly sort of on the clinical side versus the basic science side, but maybe you can give us an idea of where on that spectrum your Knowledge Forum kind of focuses.
Yeah, so we, I think, as our Knowledge Forum does consist of individuals, that are surgeons and surgeon scientists, we do have a translational, I think, bent and translational opportunity, but we do recognize that AO Spine is a global organization and is largely comprised of spinal care professionals, and we want to deliver things that people that are in the field that are looking after patients can use in their practice. And that, I think, is really I think has been the focus for our Knowledge Forum, and I think is something that we always have to be kind of cognizant of, is that we really want to do something that can support our members, support spinal professionals out there in the management of these patients.
Sure. So let's get a little granular here. Tell us about sort of your latest, greatest initiative or study that you're particularly proud of that you want the audience to know about.
Well, I think that I assumed the leadership of the Knowledge Forum a few years ago, and I think we tried to take a thoughtful approach about, okay, what are the real knowledge gaps for traumatic spinal cord injury that we could try to fill? And we see that there's a few. There's a real controversy around what we conventionally call the central cord pattern of spinal cord injury.
Sure.
This remains highly controversial, and I think surgeons around the world, we all sort of struggle with, okay, what should we do with this individual that, maybe they don't need a spinal operation to stabilize their spine, but they have a spinal cord injury and they got a tight cord. What should I do? And I think that you know, the nature of how to best manage this patient population is it's such an ongoing controversy, such a knowledge gap, and something that, because of our aging population, is actually becoming, an increasingly common problem.
Sure.
So we thought, let's try to do something that is going to get at the heart of this, and we're starting with a study to even just define what are the real outcome measures that are going to enable us to answer this question, because the conventional outcome measures of Asia grade, Asia motor score, are probably never going to be sensitive enough to really tell us, okay, what are the treatments that are really going to be best for this patient population. So we're going to take a very almost ground up approach to saying, okay, well, what do we really need to study in order to answer this question? So we see this as being kind of a long-term project, but something that is going to fill a really unfilled knowledge gap within our field.
Sure.
So we're excited about that. We also know that surgeons today they want to know, like, what's the best evidence? Like, what should I be doing when I see a patient? How should I be thinking about the timing of their surgery, or how should I manage their hemodynamics afterwards? Or, if you and I are doing a myelopathy surgery, what should I do if there's a neurological deficit? These are all things that, practically surgeons kind of want to know about. And so we're undertaking an initiative with our guidelines to say, okay, let's do a really rigorous approach to the literature and come up with recommendations that would really enable surgeons to say, okay, well, in this situation, the AO Spine guidelines recommend that I do this.
Sure.
And we think that could be really empowering for the clinical community, because we know, there's going to be a spine surgeon, in somewhere in the Middle East that is going to have maybe an intraoperative spinal cord injury, and they're going to want to know, okay, what does the best evidence tell me to do next? So we're trying to tackle that very hard question, really to try to provide practical tools for spine surgeons today. And I think one of the other things we're really excited about within our field is that, or within our knowledge forum, is that we are looking at the spinal cord injury through the continuum between what we all sort of conventionally think of, the acute traumatic motor vehicle accident spinal cord, all the way through to the slow motion spinal cord injury that represents degenerative cervical myelopathy, because that is something that is so common, right? And we really want to change the paradigm to be thinking about this as a slow motion spinal cord injury, because I think that the recognition that this does represent a form of a spinal cord injury is really important for our field. Because it is just so common and affects so many people, and so many spine surgeons around the world are managing patients with this. So we think that extending the scope of our knowledge forum to really try to address degenerative cervical myelopathy is going to be a really important contribution from our knowledge forum.
Absolutely, and I think that's kind of a novel concept that's very well accepted, in the sense that you are dealing with the spinal cord.
Mm-hmm.
I like how you called it a slow motion one, because I think that really truly represents that. You had mentioned you have a spectrum. Is there an opportunity to do translational research, basic science? How widely can you get towards that end of the spectrum?
Yeah, I think that, well, as you know yourself as a surgeon scientist, the translational spectrum really is quite broad, and really depends a little bit on how you define it. We are interested in pursuing projects that can really be driven by spine surgeons. So, one of the things that we, for example, are embarking upon within the Knowledge Forum is this idea of trying to come up with objective blood biomarkers of acute traumatic spinal cord injury, because if you lacks something objective as a measure of injury severity and better ways of predicting what patients will be like, in 6 months, 12 months time. We depend very much on the functional Asia grading, which, as you and I know, is very hard to do in the acute setting, because patients come in with multiple injuries, intoxication, sedation and whatnot. So we have an opportunity, and this is where we think it's a great opportunity for global collaboration to embark upon a project where, if you or a spine surgeon in Europe or Asia Pacific or the Middle East can enroll a spinal cord injured patient, do an examination, obtain a blood sample, and then do a follow-up examination, we'll be able to actually establish and validate objective serum biomarkers of spinal cord injury that leverages off of our, some of the work that we've already done in this space, and will allow us to partner with an international biobanking effort that we have ongoing. So we think that this is actually an opportunity for spine surgeons to really participate in the translational spectrum of research. It is we are going to be looking at biological markers, and we may try to extend that into looking at some genetic markers and whatnot. But we think that this is going to be an opportunity really for spine surgeons to participate in that kind of research.
Brian, that's very exciting, and I'm sure the audience is excited hearing about some of the things that you guys are doing. Is there an opportunity for them to get involved? If there's a member out there watching this and saying, this is of interest to me, this is my area, I practice this clinically, how does someone get involved?
Well, I think that part of it is our responsibility to get out there with the message and to actually establish the types of projects that really do provide opportunities for people to be involved. And so that's something that we're very cognizant of, and I think the AO Spine organization is, it's one of their great strengths around knowledge translation and whatnot. So part of that's our job, and within the degenerative cervical myelopathy space, we have established these incubators to initiate projects in the natural history diagnosis spectrum of studies within DCM. And I think once those get out there, then the membership within AO Spine can definitely jump in and say, hey, you know what, like, I have a real interest in that. You're doing a natural history study, I can definitely participate in that. So it's kind of incumbent upon us to get those opportunities out there, communicate them, and then and also to put in place the kinds of projects that people can participate in, even if they're not a big-time academic center, right? Like, I think that's really important, because we need to recognize that the kinds of studies that people can really collaborate on internationally can't always be like the high-tech study, right? They need to be set up as practical, surgeon-driven studies. So that's some of the things that we're being very cognizant about as we embark on some of these initiatives.
So I think what the audience is hearing, that if they want to get involved, give Brian a personal call, and he'd be happy to kind of show you the pathway. Well, Brian, thank you so much for taking the time. I congratulate you and the entire Knowledge Forum, all your accomplishments, your ongoing studies, and thank you so much for contributing to the Congress meeting.
Of course.
Yeah.
My pleasure.
Great.
Thanks, Jeff. Thanks for your leadership.
Well, my pleasure. And for the audience here, we're going to sign off for a bit, and I hope you tune in for the next session for GSC Live from Las Vegas 2022. Thank you.